Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today, I am joined by Alex MacLeod, the Director for Healthcare Solution Innovation at InterSystems. G'day, Alex. How are you going?
Hi, thanks for having me.
It's great to have you here. Wonderful to be able to connect across the world, but with such a close partner like InterSystems, who we know well here on the podcast, but we've not chatted before, and we can have some a great deep dive into this world that we're certainly watching with interest here in Australia around health information exchanges. And but they're certainly not a Australian specific thing. There's lots for us to learn from other parts of the world. So let's dive in and understand that a little bit more. Firstly, though, Alex, can you tell us a bit more about you and what you do with InterSystems?
Sure. I've actually been with InterSystems 24 years, believe it or not. Yeah,
cool.
I started as an intern.
Yeah, they've got like a kindergarten program.
But train them young. But I moved through a number of roles in which I dealt with a lot of the international client base. So a lot of the HIEs, check care records across like Europe and the rest of the world, as well as in the US early on. But now I have a role that's I consider the coolest job on the planet, because innovation means I get to play with all the, cool stuff like AI, piloted with customers across the world, and then kind of drive it or inform product through that. So
yeah, amazing. I'm gonna challenge you for the coolest job in the world, but that's okay. You'll still sound cool.
You might be a close.
But you're based in the US, is that right?
Yes. I am more originally from Germany, but I moved here 20 years ago.
Got it. Excellent. And so, look, I look at the landscape of HIEs as we start to talk a lot about them here in Australia, and I know the US is much more on a pathway, and they're a bit more of a part of the healthcare kind of infrastructure and landscape. Tell us a bit more about how the US has implemented HIEs, because I guess when I say HIE, sometimes it can be a little bit like a nebulous topic, like everyone talks about patient engagement or artificial. It's kind of like one thing, but it's a complex thing, right? Tell me a bit more about it, particularly in the US.
It is, and I think they've matured here and kind of had to reinvent themselves a couple times. But when we say HIE, we usually refer to like a regional or a state level exchange in the US. So there's a number of them here, but especially in more recent years, they've kind of had to reinvent themselves by adding more use cases. And I guess they've always had to do that, right? So you start by collecting all of the data and making that all available to a provider. Only that's massive amounts of data, and nobody wants to wade through it. Plus, DMRs have driven EMR-wide exchanges like throughout the nation. There's like at least 3 national networks now. So everyone is exchanging data at different levels now. So I think the HIEs have had to add use cases like public health, AI, what else can they do with the data? Some of them have rebranded themselves as what they call health data utilities, right? So we think of it, I always call it Disneyland, but it's this field of dreams of what do you do with all this data, and how, what use cases can you add on top of that to kind of make it useful, make it applicable, and drive value?
Got it. And so, you raise an interesting point in itself. The one reason why you may want to pool or consolidate or bring together healthcare information across, say, different hospitals or healthcare systems could be for the payer's perspective in the US, but It sounds like there's a number of other kind of use cases, and this is very much in the wheelhouse of InterSystems kind of stuff. So from your experience, what is like a successful implementation of an HIE or a good use of an HIE that and what would be like the success criteria for that?
Yeah. So and we see this over time, how some of them have become successful. So if we look at the state of New York, for example, there's an HIE called HealthTech. And I think they've been in place for a number of years, but they've reached economies of scale, and they've managed to kind of keep up with, we have to change the use cases that we provide. So early on, they were very smart about, if you're integrating tens of thousands of applications, it takes forever. to get some value out of that, right? So what do you do in the meantime so that nobody gets uninterested and moves on or questions the value you provide? So what they focused on initially was notifications, like real time. When someone gets admitted to the hospital, they send out a notification to the primary care provider. And then when you get discharged, you get a copy of the discharge summary. Like simple things like that, but at least you're providing value early on as you're building up kind of this data lake of information, right? And now more recently, they've really added like other use cases, like I mentioned, public health. So now they provide these smaller, like what they call data marts, to look at specific cohorts of the population, and kind of look at the trends, identify that early. Like we talked to a health system there recently that's part of that exchange. And it was super interesting because they have a department that's focused on STDs and they deploy mobile vans throughout the city. So they use the HIE to see how the incidence of the disease was moving. And then that's where they deployed the van.
Right.
Things you don't even think about. But when you have all the data, you can drive those kind of operational processes.
Yeah, I was thinking originally that the real benefit around an HIE implementation could be a lot around those like retrospective stuff. So understanding where to deploy resources, or importantly, how to bill and make sure things don't get missed, and that we've got some good data on what has happened in healthcare.
Yep.
But there's probably examples of it also then influencing how care is delivered. Are there any metrics that are like even worth looking at from an HIE perspective that are around better clinical outcomes, or is it more of just this is stuff that's happened in the rearview mirror and let's try and improve based on what has happened?
I do think it's incredibly hard to measure, just because you're providing kind of, like I said, utility. Like, how do you measure the ROI on electricity? Like you're providing something for the community, and then let's say they, for example, reduce the rate of duplicate tests or duplicate imaging or something. Where does that benefit materialize? Either through the payer or at the health system that saves that money, right? So it's hard, but it's not accrued necessarily at the HIE level, so it is hard to measure. But there is certain things where at least kind of they can measure relatively, like what's the engagement rate, or what's the rate of readmissions we have managed to reduce, or things like that, at least either on a per health system basis or kind of trend wise. So there's an example, for example, when they there's this nice story where provide additional services like nutritionists, health coaches for patients, right? But if you imagine you're sitting in your house and someone calls you saying, hey, I'm like a free health coach, I want to help you be healthy or not get into the hospital, you'd be like telemarketer,
Yeah.
Not a great engagement rate. So they see like 15 to 20% of patients saying yes to those services. But through the HIE, they see, for example, oh, this patient's admitted to the hospital right now. Let me deploy a resource to the bedside. And then they're more receptive. Say, oh, yeah, I don't want this to happen again to me, so maybe I'll take advantage of this free service. Engagement rate goes up to like 80%. So there's things like that they can measure. It's a little hard to put monetary value on it, I would say. But,
Well, I was going to say, like, it all makes sense, and it brings my mind to that whole back and forth conversation we have in healthcare around, well, let's see what we can do to front end load as much as possible, or look at how we can prevent issues from happening before they occur. Exactly. So then we can reduce costs down the line. But whenever we get in that conversation, it's kind of like, how do you then put on a spreadsheet or justify, like, this is what we stopped from happening because we think it didn't happen. So like, how do you, it's much easier to justify in a healthcare system, hey, these are hard costs that we just reduced because they're people or they're hard things, infrastructure, but that's not sustainable. We need to be able to find ways to reduce the costs before they happen. But that $100 million question is how do you then justify an investment to something that you don't know it's happened yet, or you don't know if it even will.
Right. And then for all the participants, the costs might be different too. So, maybe hospital A or primary care A, a no-show appointment costs this much. But at another site it costs something else. So it's a little difficult to, apply it to everyone involved.
One way I think sometimes it helps to then go, hey, look, it's worth a hospital system or a health system investing in something that might create that kind of knock-on benefit would be looking at examples that have done, and had benefit. You've touched on a few examples already, but I'd love to understand through some examples of, say, here's some health systems or examples of an HIE being implemented, and then there being those benefits, be it from a clinician side or the cost side, or however you measure it.
So I always hate quoting numbers because they sound marketing-ish, right? But let me give you another example where I do actually have a number coming from the health system themselves, but this was in Florida somewhere. And they had a lot of uninsured people that showed up to the emergency department to get primary care, right? Because they won't get sent away there. But it's really costly. Plus, the wait times are long, so it's not really the way to do it. Yeah. And they couldn't, they tried to manually identify these people and get to them with an intervention team before they go to the ED to get them some primary care services, and they were failing at that. So then they used the data from the HIE to kind of look at, and it was like a dashboard that they created basically on top of the data to look at where these ED frequent flyers, right? They keep showing up at the ED for these things that aren't really emergency or urgent care cases. And according to them, in 6 months, it saved them $2 million. That's a lot. Now, I think that's a steep, we're going to save a lot and then kind of maintains. But that's pretty significant savings if you can find a use case like that.
Yeah. And if I was, say, a health system looking at implementing an HIE and the role that it would have within our environment, what does that kind of planning process look like? Or what's really important to keep in mind when looking at, okay, if we're going to make this investment, when are we going to see the returns? How do we then put all this on paper so that it makes sense for it to get that buy-in, so that, as you say, people don't get jaded through the process when there's no immediate return, but we're in it for the long haul.
And it's hard because you can't predict all the use cases, right? Then COVID hits and all of a sudden the data is really useful, but you didn't know that before. So hopefully we won't have that same situation, but it's almost impossible to predict all the use cases. You might have some immediate ones, but I think that's where stakeholder engagement early on becomes really important. So get your clinical stakeholders, get the business stakeholders, so that right now what's driving some of their pain, and that's what we can focus on first. Those are the data types we're bringing in first, and we can, in parallel, work on this foundation that we're building to satisfy any other use cases that might come up, but we're keeping them, getting value out of it as we go along.
On the engaging stakeholders point, because that's another thing I think that no one's going to argue with this suggestion that, hey, let's make sure everyone's involved through the process, so that when we do implement this, there's no surprises and everyone says, well, we built what everyone said we should do. But that's obviously easier to say than to do.
And people never agree either.
No, well, that's right. The more people get involved, the harder it is. But that's kind of the point. You can get that stakeholders involved in building an HIE, but not everyone's going to be looking at this HIE anyway. So it can be almost like a difficult thing to identify at the start, like who's the key ones to really get involved. And maybe there's an example that you can share on, like, well, hey, here's a, rather than just being this behind the scene thing that was built that ensures data flows seamlessly and can be mined however we like. Here's some examples of an HIE that's been co-designed or built with different stakeholder perspectives, maybe even the clinical side, that brings in all those points so that it can build something that's quite robust.
Yeah, and it is hard, right? Because I think sometimes, especially in the US, you have these mammoth health systems that are kind of the cornerstones of the HIE, so they're the loudest. Not that that's a bad thing, right? Yeah. But for example, primary care, usually quieter, smaller, busy as all, like the UK, for example, with their shared care records, although they keep changing the name. I think they're like connected care records now or something. But they actually, I think, are the best example of including primary care in the process as well. But that's very difficult to get like a bidirectional integration going there and get them at the table early. But then other stakeholders that you wouldn't even think of, like you mentioned, the payers, they have, there's a bit of a limited, like what data can and can't they see, but that they have the money, right? So there is something to be said for them being involved. California in the US, for example, the way they built their HIE was 3 big health systems, 3 big insurance providers. And that was very successful. But then, do you have someone from public health or someone at the government level where it makes sense to bring them? And some other countries in Europe that we see, it's mandated by the government anyway or driven by them. So that's a little bit of a different story. But yeah, there's all kinds of stakeholders you could be bringing in, which is why I like this idea of like democratizing the data, right? Even if you don't know all the use cases and the stakeholders yet, if you have the data and you have the tools for people to look at the data their way, I think that's hugely beneficial.
Yeah, right. And I guess that's also helpful too in I guess getting a project up and going, or at least having something tangible to show that's been delivered, is that maybe you'd deliver on a baseline of like, this is what we're going to achieve right now, but it then sets us up in the future. Because you mentioned at the start too that some of the more established ones, they've definitely evolved over time too.
Yeah.
What are the types of things that you think get parked in the, like, let's put that in the, not version 2, but the later down the line, and like what's kind of mission critical, like the elements of HIEs that you're like, okay, let's keep these bits in mind for a future build, and or maybe let's future proof this thing so that we can do these things maybe in 5-10 years. But how do you then prioritize what we do right now versus what we do later?
And it depends a little bit on the use cases and the audience you want to reach, right? So there's like core data types that everyone wants to see, and if it's not there, nobody's going to look at it again, both from the provider and the patient side, for example. So if you don't have medications and lab results and encounters and allergies, or PME data, you're kind of like, that's the bare minimum that you need. It's actually funny, some of this stuff changes over time. I am a big believer in real-time notifications based on the data that comes in, because it's so easy, right? It's a very easy use case to implement without a lot of resource requirements that you can just do early. When we started with HIEs, everyone said the holy grail sometime down the road in a couple years is analytics, right? Or population health, or however you want to use it, and then ML. And everyone kind of pushed it down, and then it took years to kind of get there. We've seen that actually change more recently, because people figured out that if you feed the analytics database early, you can use that to, for example, identify data quality issues, early on as you're integrating different applications. So it morphs sometimes from being parked at the end to moving further up. In Europe, we see a lot of kind of citizen-centric HIEs. So patient engagement comes way earlier than it does in the US. In the US, it's very driven by the EMR, for example. So, it depends a little bit on the region that we're into, what they see as kind of first, what do we want to do first?
Yeah. Well, if I put all of that in context for Australia and where we're at right now, because if I was to think about it, we've got the state health systems, and which is where all the hospitals are done, and the federal system funds the primary care, which is a whole separate issue. But the each state then has got their own kind of strategy in relation to HIEs, and I think in some parts of Australia they're connecting in with directly in with hospital information systems, whereas other states are kind of building their own thing. We haven't really got I don't think we have a real consistent kind of approach to it. Is that going to bite us down the line, or is that, kind of just what you see through this evolution process of?
I actually think, we see the same thing, especially in the US, same thing. Like there were these regionals, we have the health systems actually building kind of their own exchanges, then we have the state, then we have the nationals, so it's all, but I think it's actually good. It makes sense to integrate on different levels, basically. And some organizations are more federated, some have a more central mindset. I think that's okay. Let's say, for example, here, if you look at some of the health systems that implement like one massive EMR, right?
Yeah.
Rather than different systems that they have to integrate. That's great, because then the workflow is exactly the same, data input is exactly the same. So they're already standardizing at a level that solves one piece of the puzzle that then comes, together on the higher level. So I think that's beneficial and can help, but you will always have these different levels.
Yeah. Does it make it less integrated? Like the more layers you've got in that process, aren't there more opportunities for things to go wrong? I'm thinking from my layman's perspective here, but if we're adding so many layers of HIEs that then we're going to roll them up into another HIE, and then it keeps going. We've got a big HIE sandwich going on. What's the is that a good sandwich or not?
Like an American sandwich.
Yeah, right. One of those eating competitions. But do we want that, or is there a chance that like data gets lost on the way? Is this how it works, or like can you do that seamlessly and do that accurately?
I think you can do it. There's always some diligence and discipline you need to figure out, okay, now that we're bringing it up, let's make sure. I think data loss is a very valid concern, and you just got to be, as long as you're aware, right? I think you can address the issue and make sure it doesn't become a problem. I do think there's benefits to it, like speed, right? If some of these smaller organizations already figure it out, they're just going to be more nimble than doing one massive thing. It's just going to take a while, right? So if we've already figured out these smaller pieces, I'm thinking of an analogy now that's gonna work, but it won't come to me.
Or you go back to the sandwich one if you want, but no.
I'm thinking of like Lego because I have kids, So maybe they all built their own little castles, and then the kingdom comes together.
Sure,
that was pretty good.
Yeah, I like that.
You know what I mean? I'm an eternal optimist, so I like to think it benefits.
Yeah, and if you were to, because it's great to be able to speak to someone that's, deep in the weeds of data and seeing different health systems and the successes and lessons in HI implementation. Given, where Australia is at right now, are there any thoughts that you'd give or advice to those that are kind of innovating in this space on like what's the most important things to keep in mind as we undergo this journey?
Do I go philosophical? I've seen like what Australia is playing, at least on a high level, with like the directory and then the directed exchange, whatever the 4 layers were. And I think it's a good approach. I think there is, as I said, some discipline to planning it out. Honestly, you got to stay agile, and you got to keep in mind that all of us are kind of stakeholders in the healthcare system, right? We're all patients. Some of us are doctors, but at the very least, we're all patients, we're all caretakers. You have kids, I have kids, as long as you keep kind of the greater good in mind and you do the right thing for the community, I think, you just got to keep the end goal in mind.
Yeah, that's the North Star for sure. And lastly, then thinking about as we're in 2025 now, and InterSystems are across a lot of what's happening globally in the healthcare space and data analytics and AI and everything. They're all the hot topics, and it must be all front of mind for you. Where are your kind of priorities at, and what are you looking forward to really getting stuck into this year?
Well, AI for us is great, especially generative AI, because we've been sitting, or our customers have been sitting on this gold mine of data, and it gets very unwieldy. Like, how do you make sure the people who need to see what they need to see at that time get that information? It's really difficult because there's almost too much data now. And AI really helps with surfacing that, or making you think of something you might not have thought before, or putting your attention to, hey, have you looked at this? Without you having to read massive amounts of patient charts. And we've burdened users for decades with like data entry and that type of stuff. And that's where generative AI can just ease the burden, I would say. It's a very complex domain. I don't think AI will ever replace anyone, right? It's just supposed to ease that workflow and assist, but there always needs to be a human in the loop.
Yeah.
But for us, it's great because it plays right into we have the data, kind of unsexy stuff, right? And now AI comes in and brings out the magic.
Yeah. Now it's cool. But the actually, I think I might have even been speaking to another InterSystems person elsewhere in the world about this one, because it really got me thinking. Would love your thoughts, because we've often said in healthcare, I guess prior to the whole Gen AI excitement, is if you don't need to collect the data, then don't collect it, because you're just pooling unnecessary noise and additional risk in terms of, cyber issues. And what are you going to do with it anyway? But for those that have, you raise a really good point, is that it's almost like been this long-term investment in, yes, they're in metaphorical boxes and that's unsorted and it's there, but the fact it's there and now we've got this new capability, let's say, it can really unlock a lot of potential. So where do you sit on this whole perspective of, do we just continue to collect as much data as we can and then work out what to do with it later, or are we doing really meaningful things with it now? Or what's your kind of take on what to do with all this data?
It's almost an unfair question because I love data, right? Give us all of the data we can, but it's a balance, right? It's a delicate balance, because you don't want to spend all your time collecting data and losing sight of the people who need to adopt the system. Like it is dangerous that you get bogged down and you lose sight of, the adoption. On the other hand, so you need to almost collect just enough, but in the meantime, invest in building that rich foundation that you can then use, And the beauty about especially a lot of these use cases that are analytically focused or machine learning focused, you don't necessarily need identifiable data, right? If you're looking at statistics or trends or something like that, we can do this in a safe way where it's anonymized, and you're just looking for that type of data without scaring people that they're submitting something. But trust me, I've seen some systems that have not gone very well because people were so concerned about privacy that they overcomplicated the system to where the patients didn't want to participate, right? Because it was too much work. Like if at every visit I have to decide exactly which data types are to be shared and used for what purpose, that's a lot of work for me. So I'll just say a blanket no, So like a delicate balance of collecting what makes sense, maybe you'll leave out mental health data or something like that, but collecting the rest and then using it, for a specific purpose that's very clear and transparent. I think that's the way to go.
Look, I can tell this is definitely your area of expertise, and
I got a little excited.
I'm excited, but that's okay. That's why you work at InterSystems, and that's the types of people that you'd want to work with because it sounds like that strategic thinking up front is definitely important. It's an exciting area, but then I imagine there'd be a lot of systems that could, as you suggest, kind of overcomplicate it and almost create a bit of stagnation or paralysis, decision paralysis, and not end up getting off the ground. So getting up with something that's going to be robust and allow you to build upon it sounds super logical to me. Alex, I could keep riffing with you on this for a while, but we're going to have to wrap it up in this conversation. So appreciate you making the time. Looking forward to catching up with you somewhere in the world at some point, I'm sure. Thanks so much for the conversation.
Yeah, and then we can riff some more.
Yes. Love it.
Thank you so much again for having me. It was fun.